which is great. Somebody's put in the chat about with so many priorities, it's difficult to navigate. So some hints and tips and ways of managing that. I think we'll definitely be able to provide that, but I think that's a very common theme for people. Oh, we have a hand up from Sarah, who has put her hand down. I'm not sure if that was a mistake, Sarah.
No, I'm sorry, that was a mistake. I was just trying to find my chat and pressed the wrong button.
No, you're fine. It's like it's very early for a question, but we'll take it. No, perfect. Thank you. Okay, Rick, could we move to the next slide, please? Okay, so we have already said this, but for those who are just joining, this event is being recorded. So you will be able to watch it back later, and it's going to be made available on the innovation. Oh, there's somebody with that. If you could mute yourself, that would be great. Okay, thank you. So yes, the event is being recorded and you will be able to watch it back. It is going to be made available on the Innovation Hub YouTube channel. The copy of the slides will be made available after the event, and we will use screenshots from the event in some of the communications for the Dorset Innovation Hub. So if you prefer not to be in the photos, then please either put your camera off and we will crop them accordingly. If you do use any social media and you would like to share about your experiences, then please do use the hashtag Dorset Innovation Hub and tag any of the facilitators. We're across LinkedIn and X. We aim to finish at just before 2 o'clock. So you've got 5 minutes to stretch your legs and see the sunshine before your next meeting. Could we move to the next slide, please, Rick? Okay, so a little bit of introductions about the team. So my name is Michelle Holmes. I'm a senior lecturer in workforce development at Health Sciences University and part of the Dorset Innovation Hub education team. Sarah, would you like to introduce yourself?
Thank you. I'm Sarah Chesil. I'm Head of Innovation and Research at NHS Dorset and the Dorset Innovation Hub lead.
And Rick, would you like to introduce yourself?
Good afternoon, colleagues. My name is Rick Perry. I'm a Programme Manager working at Dorset Council and part of the Innovation Hub.
Perfect. So as I said already, this community of practice we're running in partnership across the Dorset Innovation Hub, Health Sciences University, and in partnership with the National Quality Improvement and Clinical Audit Network, who have fed into our slides. Next slide, please, Rick. So in this session, we really want to talk to you about the priorities, and I think some of the things that we've already put in the chat about what you're hoping to get out of this session is about, you know, we are all struggling with the innovation that we're trying to put into our organisations, and then there are quite a number of priorities and projects that people are working on. So in this session, you know, you're going to be able to find more about the information that you need to make those decisions about what to prioritise, thinking about the context that you're making those decisions in, about evidencing the impact of your decisions, and some of those tools to support decision making. We will have opportunities for questions at the end, so a live Q&A session, but if you have any questions at any point, please you can put them in the chat and we'll try and pick them up as we go. Okay, and next slide, please, Rick. So this is just as a visual of the Dorset Innovation Hub, and this is a strategic partnership made up of partners across higher education, local organisations, local authorities, and the NHS. So just a nice slide, and it also highlights where we sit with our wider partners across Wessex. Next slide, please, Rick. And then just a really quick overview of the Dorset Innovation Hub and how it's I guess facilitated. So we have the programme group. They're likened to a mini ICP. So we have representatives across all the partner organisations, and they oversee the strategic partnership. And then we have the innovation core team, which myself and Rick sit on. So it's by far obviously the better of the two groups because we sit on it. But we are the practical support, providing advice and support. And one of those themes through that core team is the education strategy of which the community of practice is part of it. Perfect. And next slide, please. And lastly, just to really highlight the innovation website, that this has lots of key information and context. So this sets out all about the Dorset Innovation Service, the Innovation Hub. There are links to the partner organisations, case studies, our training opportunities. So not only do we have this community of practice, but we also have our fundamentals of innovation adoption, which is a free one-day training on innovation adoption held 4 times a year, twice in the east of the region and twice in the west of the region, and that will have upcoming dates for that training. There's also a number of resources, frequently asked questions at news and events, so please do go onto the website. You can also sign up for the newsletter there as well. And with that, I am now handing over to Sarah Chesel, who's going to talk you through prioritising the priorities.
Thank you, Michelle. And we've got some great points that people are raising in the chat about what they'd like to get out of the session. This is a micro teach, so a mini teach looking at how we can prioritise the priorities. And I think with some of the points coming through, it's really key that we recognise that as a community of practice, we've got some questions at the end. So if we don't cover the points you want, please let's ask the questions at the end, and Rick is keeping an eye on the chat as well. But as you can see the visual here, we recognise that there's multiple signalling with priorities on priorities on priorities, and you can keep repeating and repeating. But it's actually about recognising, whilst as Michelle has introduced, the Dorset Innovation Hub focuses on innovation. We're making this more generic because this was a point that came up through the National Quality Improvement and Clinical Audit Network as a key point where folk were struggling with the massive priorities, multiple priorities, and this is the priority. And actually, how can we have a sense of getting balance, being able to move from an unclear, chaotic position to a more informed and clearer position? So I hope that you find this little session helpful. Next slide, please, Rick. Thank you. So as I've just started to allude to, whilst our focus is on innovation on our day-to-day work, innovation is part of the quality cycle where we look at multiple different approaches. So what we're looking at here is when we talk about a project, think from your own perspectives in your role, in your organisation. Think improvement, think clinical audit, quality improvement, and the two can be different, so improvement and QI. Think research, transformation or innovation. There may be many other different projects, but generically think from your perspective to apply these key points. So we know there's multiple signalling, but it's thinking about what are the priorities within your team. So you as an individual, and I really would ask that you reflect on the points that I raise and just think about how you're going to take the points back to your workplace, back to your work, and how you will utilise some of the points that are raised. So priorities within the team, your organisation, locally and nationally, and this is multiple priorities. But what we have to recognise and what we need to legitimise is there's limited capacity. So we know that within teams, and particularly when we look at quality teams, limited capacity, whole time equivalent, numbers of staff that can actually take forward key projects. So we need to really make sure we're focusing on priority projects, doing less projects or initiatives, as you may call them, less projects, and making sure we're really doing them well. And so this is this generic overview and the key points I want to get across. Also looking from a generic lens. So this was raised as a subject and a request for a community of practice as part of the NQICAN, National Quality Improvement and Clinical Audit Network discussions within the community. And Vicky Patel, who I'm delighted is on this community of practice today, asked whether we would undertake this community of practice. From the perspective of, it's not just about staff that are providing facilitative support or undertaking projects, but actually it's really helpful for individuals that are seeking support from those type of people so they can be really clear where we're coming from, and we'll move to a position of talking about enabled informed decisions. I've got a couple of slides towards the end. So that's that framing. How do we make informed decisions regarding priorities? And how does that then help us have informed conversations? So next slide, please. Thank you. So just thinking about that just for a second, and Rick, if you can help me with picking up some bits in the chat as well, just want you to think about how, if you're making an informed decision about taking forward a project, what information do you feel you need? So there's no wrong answers. If you can just pick up on that point and quickly pop in the chat, what information do you feel you need? So this is from each of your perspectives. So just wait while people are popping things in the chat. Just waiting while people type. So we've got risk consequences of not doing. Is it an unmet need for the trust? Brilliant, love those two. How does it align with the organisational system level priorities? Absolutely. Understanding how and what I am. Oh gosh, I'm reading and chat's coming in. Let's move on. Understand how what I'm being asked to do and how it fits with the team and department aims and objectives. Absolutely. Is it a must or is it a nice to do? These are brilliant answers. Why this ask? Why now? What's the concern? Expected impacts. These are absolutely brilliant. So I'm really hoping that these points resonate with you. Rick, have you picked up anything else that you really feel we need to just outline from the chat?
The one that leaps out, Sarah, is the impact on patients and staff. You know, that is about the resident, isn't it? It's about the user. And so having information about that in order to help prioritize has got to be in there. But yeah, loads of great ideas in the chat.
It's fantastic. We've got a great group of folk here today in this community of practice. And actually, we also need to, and I should have said right at the beginning, we're all learning from one another. So if you really feel something's missing, please pop it in the chat or do raise your hands and we'll have a look at that. But it's actually about how we can understand from individuals' angles. Rick, thank you for raising that point. Really, really important point. So let's just come into the next slide, please, Rick. And thanks everyone for popping your points in the chat. Really, really great points. Thinking about the activity that we just briefly looked at, we're just going to explore some of the information that we recommend that you need to make informed decisions. And I am so delighted, so many of the points you've raised are on our list, and there'll be some others. I'm going to go back through this. We're going to make this available as a resource for you after the community of practice, so a few days afterwards. So it'll be on Future NHS. We'll send you an email. And it is a busy slide, and the team said to me, don't put it all on one side, but I wanted everything to be together so you can see it all in one. So think of this as a checklist to provide information needed to make informed decisions. So as we've seen in the chat, things like what's the need, why this area, and now. And as a threaded example, I'm going to use one where we're looking, or we're actually undertaking a project at the moment, which is using asthma diagnosis and management as an example, and it's health, and I apologise for that. But each of these points, just think back to your own work, your own situations, and use your own example. So asthma, if diagnosed early in children and managed well, reduces the impact in later life. It improves patient outcomes and reduces the risk of exacerbations and admissions to hospital. So why this area now? So when we look at Dorset, there is a growing demand of patients with uncontrolled asthma that are coming to our emergency department, and actually that is really not very good for the patient. So why now? It's an absolute priority because we're seeing more patients with exacerbations where they should have controlled asthma, or it could be that it's undiagnosed and actually we should be diagnosing better. And that's what we think about with the current compliance. So actually, if we think NICE guidance, we think about outcomes. You know, do we have, when we look at our data, which is so important, do we have data that says we're an outlier? What does the National Audit for Asthma tell us about the data locally in Dorset? So as we think about that risk and impact, and for what population, it is about looking at that preventative approach and looking at, can we diagnose earlier in children, so catching children younger and manage them better, so there's reduced impact, as obviously people go into adult years. So thinking about the risk, thinking about the potential for the population, thinking about the pathway. So not just thinking about asthma in isolation, so thinking about the pathway for patients and what's in place and already being used. So don't just look at the acute exacerbations, be thinking about, so what's happening within primary care, what's happening about the management within the GP surgery, what's happening within the acute sector, the providers as well. And what is being used. And NICE guidance has recently been updated to prioritise FeNO, so fractional exhaled nitric oxide, where the evidence is now much stronger that we should be using FeNO in the outpatient setting, both for the diagnostics as well as the ongoing management of asthma. And that actually is looking at also reducing overuse of steroids, so making sure we're actually appropriately providing treatment for patients. Think about the stakeholders. So I've talked about GP surgeries, I've talked about the acute, and think about how that actually supports your discussions with regards to the project. So it's, how are we taking forward this priority project? So actually, do all the stakeholders agree it's a priority? And think about the whole pathway for that member of the population, that patient or service user. Evidence-based, think about NICE, think about National Institute for Clinical Excellence, and think about, sorry, it's just come up in the chat and I've literally said it out loud, but thank you, Michelle. So National Institute of Clinical Excellence, there are various other bodies as well. And you can see that coming up in the chat, and thank you for popping that in. Also think about commissioning. So I work in an ICB, NHS Dorset, so think about that move to strategic commissioning with the blueprint and thinking about population health outcomes, and actually looking at, strategic commissioning, looking at how do we improve the outcomes for patients with asthma and making sure that actually providers are improving outcomes. Think about also the flip side, what's the risk of not undertaking the project, and make sure you're really clear on that, doing a risk review. And think about what resources are needed. So the hours, both for the team that are undertaking the project, but also for your own team. So thinking about clinical input, etc. And capability. So do you have all the skills within the project team? So this is good project management, to be able to undertake all elements of the project. And one that's surfacing and bumbling around in Dorset a little bit is, do folk have the skills to be able to undertake the evaluation of the project? So to measure what the actual key findings are. So really think about those skills, who can input data, who can analyse, who can write up reports. And thinking about mapping where this project sits. So the area, if I look at asthma, that is a clinical priority that it's mapped to. You think about economic elements as well, workforce, housing, and net zero. So I've talked about reduced prescription of steroids. It actually fits in with net zero. So it's actually a benefit for net zero as well. Think about wider within the ICP. So thinking about housing, damp housing and the impact that it has on asthma patients or living near busy roads. And thinking about the workforce. So do we have the population that isn't actually able to work because they are too poorly? Thinking about the priorities, so thinking about, is this a priority for the individual, the directorate, the system, so that would be Dorset for us, the region or nationally, and asthma as an example is a national priority. And then think about where it fits on the delivery plan. So is it your operational plan within your organisation? So does it fit from the NHS England operational plan, or the one that your organisation has? Does it fit in with your research or innovation delivery programme or your clinical audit plan? Next slide, please. Thank you. So I know there's a lot to think about there, but these are key points. So I'll do this in a word checklist for you and with these supporting frameworks as well, because these are points that you can think about as you think about approvals. So prioritising frameworks, I talked about the operational plan there. We've got all the links, so you'll be able to click on these. The new one that was in the NHS England weekly update this week is the Quality Impact Assessment Framework. Do have a look. It makes a really good read and really is pulling in those threads. ICBs are required to have 5-year forward plans. So looking at strategic outcomes, population health management, and you can see the others here we need to think about, and there will be many more. If you've got others, please do pop it in the chat and then I'll recognise your organisation and add that into the resource document as well. So think about things like organisations accreditations, a joint advisory group for, we've got gastrointestinal endoscopy, for example, being one. Next slide, please. Another way we can think about prioritising the priorities is thinking about getting your long list of priorities down to what are seen as the priorities. And part of that rationalisation is being able to think about having a balanced programme of priorities. And this is a tool we use for innovation. There's one for clinical audit as well that is part of the Healthcare Quality Improvement Partnership that has been badged by NQICAN, so National Quality Improvement and Clinical Audit Network. And it really allows you to look at what is the category of each of these priorities. So you can see the national must do, apply it to whichever project you're doing, be it research, be it innovation, be it transformation, etc. The should do's down to the local priorities. And as you get down to number 3 and number 4, the doing now and need to spread may not apply to your delivery plan, but it could do. So actually, if we've got asthma and pheno being used really, really well within one PCN, what about the other PCNs, primary care networks within your system? And then would like to do is really, is that an individual priority and is that a priority for you to support with? So this is a visual tool, and it's really thinking about what visual tools do you have for prioritising, and also thinking about what checklists do you have in your organisation. So next slide, please. So some key considerations, just to build on some of the points that I've talked about with the checklist and the prioritisation visual, is really to think about, this is about being able to make informed decisions. It's about staff at all levels considering the impact of taking forward and not taking forward a project. And it's really important that we're thinking about that, as I said at the beginning, when we're thinking about every facilitation, every conversation, so that it's clear that you're talking about working on priorities. So folk are really aware of that. Be clear, so please go back to your organisation, and if you're not aware already, find out what your approval process is for clinical audit, for research, for innovation, transformation. Find out what your checklists are and what documentation you have in place, because I cannot express enough how important it is to make sure you're doing what your organisation governance processes are. We must make sure we stick to those. So use a checklist. If you haven't got one, you're welcome to utilise the checklist we've talked about. Tailor it to meet your needs of the organisation. Make sure you're really clear in that rationalisation about the risks and thinking about the impact of not taking forward. So you're really citing your approving body of what the risk is to them. So is it risk of life? And I say carefully, and hopefully X is not listening, but if you look at Musk going in with Doge in America and slashing some of the vaccination programs, there is an immediate impact to those that aren't being vaccinated in third world countries. And they're talking about 55,000 lives have been lost because of that decision to stop that vaccination program, or America's input with it, because it's an international program. So be really clear, what is the risk? And also think about how you can replicate those decisions. Okay, so is it on the back fag packet, has a decision just been made? No, it's not a priority. Or can you replicate it? So can you look at the checklist and say, you've looked at this evidence, this is the risk, we have made that informed decision? Because if we're challenged as individuals, as facilitators, project managers, we need to be able to go back and replicate that decision as necessary. Think about the delivery plans that you've got in place. Think about considering shifts. So we've got a lot of evolving changes, and the announcements coming out from government, from Sir James Mackey, NHS England, and the changes coming through. We're expecting the 10-year health plan. Apologies, I'm very health related, but we're expecting that, I think, Saturday on the NHS birthday. How will that change our priorities? Be agile, evolve as these priorities come through, and think about that for your delivery plans. But the absolute key is we must focus on delivering this balanced programme of prioritised projects and have that duty of evidencing the impact. So any project we're doing, make sure you're looking at the outcomes, you're looking at that benefit realisation, that you've actually made a change for the good. Because if your project is showing that actually it's making things work, you equally need to go back to your group and say, we might need to stop because this is making waiting lists longer or is not improving care. Next slide, please. Michelle, I'm aware of my timing. I will speed up. Key considerations, as well as thinking about, as I've said, the evolving needs of the system. Think always about the capacity and capability with your team and the project team. So when we look at things with COVID, we had to down tools on an awful lot of projects. And when we look at research, we got to a point of what was essential research that had to continue to be undertaken because of cancer treatments that were being provided, on what had to stop so we could do urgent public health studies so that we could provide those accessibility. I've just got in the chat that the publication of the 10-year plan is going to be tomorrow. So that's fantastic news. We'll all be waiting with bated breath. We need to think about as well, what if demand outweighs capacity? So that's demand both for the clinical team that are doing the project, it's demand for your project management office, the project team, and thinking about your capacity. So do you actually keep a log of how many projects your team are doing, how you're doing capacity wise, how pushed are your team? Because when we think about capacity with beds and bed states, we think about we should be at 80-85% capacity. If your team are running hot and running at 110% and you're running from one thing to another, something will give, and we really need to think about those human factors and think about our team. So less projects that are priorities and doing those projects well. We need to recognise we can't do everything, need to review and adjust our delivery plans, and we might need to say, we've got to stop that project for now, we're going to stop it, we're going to pause, we're going to stagger it, we're going to delay the project, or we might actually say we'll do it in the next financial year. We've got to remember that we are facilitating these discussions. Unless we are very senior, we will need to go back to our senior responsible officer, our approval groups, our executive officer, just check and challenge. Can you check you are happy with the decision that we stop this project? So escalate to your SRO, clinical director, your executive officer to actually make sure you've got that support. Next slide, please. Thank you. I'm aware that that's throwing a lot of information for you. These slides, it was asked in the chat, these slides will be made available. Please see it as a resource. I've written it in a way that you can go back to. But with the Future NHS platform invite that you'll get, there is also a chat functionality. Please pop questions in the chat or pose queries, and I will get back to you on those so we can have an ongoing conversation. But for now, can you let me know what you feel, your personal thoughts, you feel influences decision making? So we'll just spend just 2 minutes on that, if that's okay. So I'll just give a second for folk to be able to write it in. So what do you feel influences decision making? Budget, yeah. Shouldn't always be budget though, should it? Just waiting for other points to come through. Could be capacity, as I've just been talking about. You seeing anything else in the chat, Rick? Oh, more coming through.
Yeah, so we've got time and staff availability has just come in, and now a host of things are coming in.
Yeah. Brilliant. You're right to just do a mini roundup, Rick. Oh, you're on mute, Rick.
Yeah, so we're seeing things like needing to make a decision really quickly. Sustainability is in there, which I think is really interesting. Angela's point about who can shout the loudest. Yeah, and we've all been in organisations where that has happened. And then sometimes you do get that personal preference coming in. External pressures, as mentioned, Sarah, the politics of it, and that's going to influence decision making. And then hearing negative perceptions, experiences of similar initiatives, that will influence decision making as well. There's a couple of points around being time bound, changing policy nationally. And my favourite, which has already had a thumbs up, is the culture of the team. And I think that is just so important and in many ways difficult to get right, isn't it? And then finally, environmental, physical factors that have come into it. So loads and loads of ideas in the chat, Sarah.
Brilliant. Thank you, Rick. I really appreciate that. Wow. I genuinely, and I don't say things lightly. These are fantastic points and so important. I'm intrigued on the sustainability to meet demand and savings. Can we just have open mic on that one? From what perspective do you mean sustainability? Sorry to put you on the spot, but do you mean keep taking a project forward and making sure that it is sustainable, or having the staff there to be able to sustain the project?
Sustainability was mentioned by Ruth. So Ruth, if you did want to comment, please say. Sarah Frigate, you also mentioned sustainability.
Yeah, it was Sarah, I think, was the one I was thinking. Sarah, do you want to come in?
Yeah, no, that's fine. I'm thinking in terms of both, really. I think there's sustainability in terms of making sure that the outcome that you're trying to achieve is actually going to be beneficial for the people that we're supporting going forward and the demand coming through, and also the sustainability of the project, because if you haven't got that outset right and the resources right, then the project's not sustainable either. And so you're looking at all of those different aspects, really.
Absolutely, and thank you so much. And this, we could summarize the communication, the community of practice from that perspective itself, because it is all these multiple elements that we have to consider as project managers, as facilitators, and hence the checklist brings in so many elements. Sarah, I'm going to add in sustainability and thinking about demand. Well, we've got capacity demand in there, but sustainability from that perspective to the resource. So thank you. Coming to the next slide. Thank you, Rick. So the influence and the impact on context, we've just started to think about. So thinking about getting a prioritized, balanced program is really tricky. And we've already talked about escalating as necessary, using a checklist, it being replicable. But thinking about equity in decision making, and sometimes, and it's been added to the chat, but sometimes there are influences, multiple influences on decision making. And it's thinking about, and I've put here the impact that the context within teams or organizations can have on influencing decisions. So somebody put in the chat about perceptions and experience with similar initiatives. I think Rick said that was one of his favorite points. But it's thinking about things can be complex because of the history and the culture within the system or the organization and the team. And we really need to think about those human factors, those points that actually will affect the success of a project and the success of having conversations and taking forward those conversations. So being mindful in the discussions, the influence of an individual, and we know when we look at certain discussions that we might have a very influential person that's saying, no, absolutely not. They don't want to change their practice, or they feel that there isn't a problem. And thinking about the team's motivation to take forward. So it can be both positive as well as negative, but triangulate all that information. So we're fact finding really to make sure that we've got the best decisions to be able to say this is a priority project and we want to take it forward. And as I've already said, we need to evolve and need to change what projects we're doing as things change within the financial year. So we need to keep agile, we need to evolve. And again, we need to think about, and that was brought up again, and thank you, Sarah, about the capacity of your team and actually how teams are feeling. We've got a lot of teams out there that are feeling tired at the moment, and we need to recognise that and legitimise that as part of our programmes moving forward. And my team will tell you I talk about that quite regularly, so folk are aware. It's about giving some space and capacity so that we can do project management well. Next slide, please. Oh, I've just got a lag time on mine. I know that Rick has pressed the next slide. That's coming up now. Thank you. So we've recognised there's multiple signalling priorities. It's now thinking about the right approaches on how we can move from that unclear, chaotic position to an informed position that allows us. So we've talked about the checklist, we've talked about the balanced priorities, we've talked about balanced programs evolving throughout the financial year, but or academic year, whichever year you use. But it allows us to move to a position where we consider we can have enabled, informed discussions. So next slide, please. Forgive the emojis. Allow me to use emojis in a way of trying to generalize the faces that many of us or all of us have seen in all its guises, from the smiley face through to the angry face and the kind of that straight line where you're thinking, what are you thinking? What's going on? Thinking about right back at the beginning where I outlined about the session where we need to apply this to those that are providing facilitative support, undertaking projects, but also thinking about those that are seeking support for projects. So just pausing for a minute, I'm sure each of us have seen many of those faces and we're faced with them and thinking, crikey, what do we do now? So it's thinking about facilitation can be tricky. And then we're talking about speaking from an informed perspective, and it enables us to be more confident in our facilitative conversations. These are vital conversations. We've got to be mindful of individuals' responses, and we've got to think about these conversations and what these projects mean for individuals. But we have to move away from an individual's priority to an organisation or a directorate priority to make sure we're using our resources, our capacity wisely. Going then to the next slide. So going into these conversations, again, it's using these tools in the toolbox, the checklist, the prioritisation categories, the balanced programme, to be able to outline the rationale and the need to focus on priorities. So there's a recognised governance approach that isn't seen as bureaucratic. It's open at the point of contact. People know what's happening. It doesn't take huge amounts of time. It's accessible for people, and they understand. They will buy into that process. People need to understand about those agreed priorities. Recognise the type of project, and this is really important because if it's research and looking at new knowledge, in the research programme it could be really important, but it's how you're taking it forward. And thinking about clinical audit when we're looking at the evidence base, and are we actually providing the care that evidence says, so National Institute of Clinical Excellence says we should be delivering within that healthcare setting. Recognise the importance of the individual's project. So that's about being humanistic and recognising this is a really important priority. However, we have to look at the other priorities moving forward. So not saying, no, this isn't a priority. It's recognising the project, recognising how important it is to them. And being really clear about actually you're going to seek advice whether this project can be taken forward or whether you feel it perhaps can't be taken forward. So thinking about, is it a local priority? Is it an individual priority? Is it a system or national priority? And be aware and be mindful. So these vital conversations, thinking about the individual, and this is about, facilitating constructively with dignity and respect. And you are expecting that conversation to be equally the same. So you're receiving it in that same way, but consider the stages of how people feel. So they might come in not feeling very happy and come out smiling, or they could come in smiling, they're going to help me, they're going to help with the project, this is going to be done for me, and come out feeling a little bit frustrated. So thinking about the conversations and how you can best support them with that. Next slide, please. Last one, Michelle, and then back to you. So think about, and really key, moving from an individual's priority to an organisation's priority. Think about the pathways and think about your stakeholders. So don't work in isolation to make sure it's a really informed decision. Be clear in your organisation about the approval process, the checklists, the documentation your organisation requires you to use. We facilitate conversations, discussions, make sure you are escalating those and actually making sure the decisions are made by your senior responsible officers and approval groups, and make sure those conversations are enabled by informed decisions. We need to facilitate considerably, so think about those vital conversations and how we can support one another as trying to take forward the best for our population. And focus on those needs and benefits. At the end of the day, the majority of us are paid by public money. We have a duty of care to make sure that we're realising benefits, so improving outcomes for our defined population. Really important. Over to you, Michelle, and sorry I've gone slightly over.
No, you're fine. Could we go to the next slide, please, Rick? Perfect. So we have about 5 minutes for a bit of open mic, so an opportunity for discussion. Does anybody have any questions? Feel free to put them in the chat or to raise your hand. Whilst you're all thinking of your questions, I have one, Sarah and Rick, about do you have any examples that you might give about where you have prioritised the priorities? I guess thinking about that, going from the national must do down and how that might have been applied in practice.
Great
question. It's a good question, Michelle. I mean, for us in adult social care, you can imagine that the number of projects, well, I could have an army of project managers and still not deliver it. So yes, we do go through a structured approach of filtering out those projects and deciding which ones are the priorities, mainly led by the national picture. So CQC and the requirements around CQC is a classic example of that, through to the needs of the organisation. So we really focus on those things, very much in line with what Sarah's just described, to be able to filter those projects down into those kind of categories at the top, those top two. So
thank you. From my perspective, there's multiple examples, but it's really sort of looking at these high levels. So things like children and young people, healthy weight, and a myriad of projects that can come through where folk are thinking in isolation. So it's how do you look at that pathway and look at what are the key priority projects to take forward. And one of the things where we tend to be so busy in the type of work we're doing is just go. It's just project initiation document, seek approval, going through. Yeah, but what about that wider pathway? What about what's happening in the local authority, in the acute provider? What's happening in the voluntary and community sector assembly? Pulling the threads together and doing those type of workshops that actually enable us to make an informed decision. One with the asthma perspective, the asthma FeNO, fractional exhaled nitric oxide, was actually looking at the NICE guidance, was really helpful, because NICE can sometimes say you can use X, Y, and Z to diagnose. And actually, when there's more clarity, you actually look at how you can take forward against evidence base, and that actually helps inform your decisions. It's really hard to say to someone, I'm sorry, but we can't help with your project. So as a team leader, I look in every way to be able to try and support. So for innovation, key priorities for a couple of our providers, we said we cannot provide advanced support, some 60 hours of project management support, but we can do a light touch, and we look at about 14 hours to help them get their project off the ground with those same principles, but recognising it's that lower local priority. I hope that slightly answers your question and helps folk.
Thank you for those examples. They're great. Are there any other questions or thoughts of Victoria?
Yeah, I was just going to make reference to where you talked about having that senior responsible officer or your exec starting to support you in making those decisions, because I thought, again, that was really important, because we're not on our own on making some of these decisions. And I think it almost gives you permission then, doesn't it, to spend that resource on that time on those initiatives and projects if you know that you've not sat in isolation making that decision. So yeah, you're not on your own, and totally agree with you, Sarah, about the systems and pathways.
Thanks, Vicky. Michelle, if I can really quickly come in, Vicky's point is really important for a couple of reasons. The SRO and being able to escalate, going back for decisions, but actually we've had a couple of projects and we will not move to the next point of working up documentation until we've got a confirmed SRO. So within that project team, you have got a senior responsible officer that actually is fully aware of the project, supports it's a priority, and is able to help frame that from a perspective of what's really a priority within that organisation or that directorate. So it might be your executive officer, it could be a lead clinician or a lead nurse, but that actually is something where you can pause until you've got that SRO in. So really, really important.
Thank you very much, Sarah. So I think if there are no other questions, and as Sarah said, when these slides are made available on the NHS Futures, then you will have the opportunity to type questions there as well. I think, Rick, if then we move on to the next slide, please. So we have a whole list of recommended resources, tools and guidance, and all these links will then be made available for you. And also the links that were from earlier that Sarah had highlighted. Any that you really want to pick out here, Sarah? No, they're all important.
They are all important. That Dorset Innovation Hub document might be helpful, but do actually have a look at the NQICAN frameworks. It's the adapted from, and it says final. It's adapted from the Healthcare Quality Improvement Partnership, and really it's using that in earnest. I can see you've got hand raised.
Ash, you've got your hand raised.
No, it's not. It's to reinforce Sarah's message. So hi everybody, I'm Ash. I work with Sarah. I'm the Deputy Director of Partnerships, Research Innovation in Dorset. So we work as a team. It's a very small team, but it's great. I think that one of the interesting things is also, and I think Sarah, when we do this, is keep an eye out for the King's Fund, NHS Confed, and Sarah always says this, don't you? They will put out some really good sound bites and analysis on the 10-year plan. So very soon after something comes out, keep an eye on, they'll put them as your holding points in your sort of favourites, and just keep an eye out for those. I know we will probably through the community, Sarah always puts these out anyway, because there's such good, rich information, aren't they, Sarah? And the 10-year plan, that's the thing. Definitely, if you're going to start wanting to understand that, go to NHS Confed, go to King's Fund. They will do some fantastic bit of analysis for you, which means that it breaks down all the detail, and it's fantastic, isn't it?
Yeah. Absolutely. Thank you, Ash. Michelle, just really quickly, there's a point from Rob Fanner who's shared another framework with us. So Rob is with us with the Dorset Innovation Hub and part of the Arts University Bournemouth. So thinking about culture, and he's put in a link to the Competing Values framework by Quinn and Cameron. So I'll make that available on the resource as well.
Thank you very
Rob.
much for that, Rob. Okay, if we can go to the next slide, please. I know some people have already had to drop off, but we just want to do a quick evaluation. It's really important to the education programme that we get your views. So a poll should have launched. It has launched on my screen. So if you can complete that poll, there are 6 questions to go through. It tells me how many people have responded. We're not quite there. We're not there yet. Yes, now we can start to see some of the responses coming through.
I think it's because folk go through the 6 screens and they have to
go
think
through
about,
Yeah, absolutely. So I'm just going to hold on whilst people have a time to complete that poll. Sarah, you don't get to complete your own poll, unfortunately.
Do I not? Oh,
No.
that's rotten.
Nice try, Sarah.
Why not? I'm joking. Just remembered I'm being recorded because obviously we're making this available on YouTube. So yes, I am joking. Those of you watching it on YouTube afterwards.
And so as people are just completing that, Rick, will you just move to the next slide, please? So it is just to say thank you really for taking the time to join us today. There is a drop-in session that is on the 14th of July. And so that is really the opportunity. If you have any further questions that you want to ask, if you've had further thoughts, then please do join us at that drop-in session. The contact email is there as well. I'll just drop that into... Oh, I was going to drop it into the chat. Try and do that now. Multitask. Nope. Rick, would you type that into the chat for me while I just carry on? So as Sarah has alluded to, these slides will be made on NHS Futures, so you'll get an invitation. Oh, we've got a hand up. Sorry, Amanda, you've got your hand up.
I just wanted to ask, the drop-in session, is that about prioritising? Is that if we come up with any questions? Okay.
Do you want me to take that, Michelle? Or
yes, please.
Yeah, so we will just make ourselves available for half an hour, and if you've got any further questions from what you've heard in the community of practice, you can, depending on how many is on the call, we have great discussions about key points folk want to talk about. It could be a specific point, it could be quite generic, so it's down to you. I'll email out the invite for those of you that have attended. So
okay, thank you.
And do please get in contact with any other questions. I have managed to put the email address in the chat. So you'll be invited to NHS Futures, where you have the slides available. You can comment there, and do please spread the word about our other community of practices, and look out for the next session, which I believe is on qualitative evaluation, and also our fundamentals one-day programme, which we're having one on the 17th of July as well. I think there's only one more slide. Is that right?
I think you're there.
Oh, that's
Michelle.
the end.
I think
Okay.
you're there.
Thank you.
Almost
1 minute.
bang on time.
1 minute over. Thank you all so much for attending, and enjoy the rest of your afternoon.